after you've laundered your gown and you've lint rolled it, got all the hair off, go away, Izzy. You're gonna take it. You're gonna accordion fold after you have it right side out. Fold to your inside first, and then fold and fold. So the inside of your gown should now be on the out. Grab your armpits, get it as flat as you can, put it on here, straighten it out. And you're going to take your armpits, come to the back, make sure to leave your neckties out, and we'll show you why in just a minute. And what I like to do is take it, fold it in half, and then fold it back, and fold it back. So the reason why we leave the neckties out is your doctor's going to grab it. They're going to see their armpits are right here, so that they can take their gown, open it up, and get dressed. Okay, so after we have our gown all folded, you're going to grab a towel. Make sure it does say SX for surgery. We only want surgery towels in surgery because those are washed separately, they're cleaner, and that's what we want. Every gown should get a towel, because after they wash their hands, they open the pack up, they use their towel to dry their hands. Then on top of your towel, you're going to place one of your little indicator strips. If it doesn't have an indicator strip, when the doctor opens it up, they have to stop, put it away, go rewash. So always make sure that you're putting that in there, because that's the only thing that tells them if it got sterile or not. So you're going to open up our big drape wrap, and you're going to put it diagonally so you have a little diamond here. You're going to take it and put your gown lengthwise here in your diamond. You're going to pull the first side up. You're going to make it as tight as possible. So pull that around and then pull that in tight. I'm going to pull it over and over. So the important thing to remember is when you're making these, make your tabs with the point facing away. What this point tells us is what way to grab it to pull it. So when I pull this, it's going to pull the whole thing down. If you were to put it in like this, have your point this way, I think, oh, I need to grab it and make it go that way, but then it doesn't, and I can potentially break my sterility, like if I'm opening a pack or something else. So always make sure whatever direction this needs to pull away, that's which way your point needs to go. So I'm going to put that back in here. Make sure it's tight. Make sure this top layer is completely covering whatever it is you're wrapping. We don't want to see it. And you don't need to fold it up super tiny. Doing something nice and big like this is just fine. It's perfect. Doesn't matter if you do left or right. It's totally up to you. Just pick one side. And again, we're going to take it nice and tight. Pull it over. For something this big, leaving it just like this is perfectly acceptable. They can still grab that, open it up. The only thing to remember is when you're bringing this other side over, we want to completely cover that tab. So I can do just a little fold over, that way I know it's going to be covered. I'm going to pull this side over and making sure it's still tight. And pull it over. You can't see my point on the other side, so that's good. I can leave this just like that. Fold it over. And now what we've done here is we've made a little pouch. You just put it in. Just like that. Make sure you have a nice little tab to grab. Next layer. Grab a nice big one. We're basically going to do the same thing all over again. Make your diamond. Put this in the middle, and what you want to do is make sure that your little tab is pointing away from you. Just do the exact same thing. Completely cover it. Just like that. Pull it so that you know it's nice and tight in there. Stuff it in there. That's nice and tight. We want it tight. That helps to preserve the sterility after it comes out. General rule is you want to be able to drop this on the ground without it popping open. We're not going to throw this on the ground, but if it were to happen, we don't want this opening up. So next thing is you're going to take your tape. You do not need a lot of tape. You just need a little bit on the outside. That tells us after it's been through the autoclave, yes, it got to temperature. Always leave a nice little courtesy tab. That makes it so much easier for opening these, especially after they've been through the autoclave. You only really need about that much tape. And you put it over the top just like this. And then we're gonna write on here what it was. It was a medium gown. If you need to beforehand, especially because things get really busy, write it out on the tape before you start wrapping. That way you know, oh hey, it was this gown, this drape, whatever. That way you don't go, what was it, and have to start all over. So we'll put our date on here. And it was a medium gown. And your initials. And then we still have enough space on here. When we go to put in an autoclave, we'll put either number 1 or number 2. That helps us to track if we're having an issue with an autoclave, if we're seeing a bunch of things coming out of one, maybe it looks sterile on the outside, but they open it up, it's not sterile on the inside. That helps us keep track of that. That we know what needs repair and what doesn't. And that's how you do a gown.